Hello. So here I am again with my gray wig, except this is a different gray wig. So I have two different types, and for those of you that don't know, I am trying to become Storm for Halloween for my kids who have asked me to do that. I don't even know why I'm putting so much effort into this, because probably next month they're going to want me to be something different, but took the idea and I'm running with it, and we'll see what happens. Anyway, you clicked on this video because most likely you want to know what to do about a mean nurse in the facility. Say you're still in your clinicals and you are assigned to a nurse for that day in your clinicals, and they're just mean as hell. It has happened to me 2 times in clinical. One time was extremely ridiculous. I mean, they're both ridiculous. Let me just tell you that. I mean, I'm sorry that you came to work and you didn't know that you were having a student for the day, but that's not my damn fault. Nor is it your fault. So let me give you advice on how to deal with that. Gonna set the timer for 5 minutes and hope that I can get this all out. So anyway, you get on the floor, you introduce yourself to your nurse, and they just snub you. Like, they don't even say hi. This is also for people that have become a nurse and you are a graduate nurse and you are encountering preceptors that are just jerks. Like, there's no way to get around it. Here are some things that you can do. You can ignore it. You sure can, but it would make it difficult for you to do what you need to do during your clinicals or during that time. You could also report it to your floor nurse, your clinical nurse, basically, the one that's there for you in clinical. So your professor. You could report it to them and you wouldn't need to stress out about it. That's what the number one thing that you should do. You could also pull them aside and ask them what it is that you could do to make their lives easier so that they don't stress out about you. Now, say they respond to that rudely. Take it straight to your clinical professor and let them deal with it. They can reassign you to another nurse. If you just don't want to deal with it, period, take it to your clinical professor so that they can reassign you. Because it's ridiculous that you have to deal with that, but unfortunately it is a fact of life or a fact of nursing. My situation, I came on the floor, I introduced myself to that nurse, and she totally did not even respond to me. She acted like I didn't say anything. I said it again. Like, I introduced myself again, and they did not respond to me again. So during report, another nurse saw how she was treating me, and she was trying to, it was the night shift nurse giving a report to my nurse. She was trying to make the situation less uncomfortable for me. So she was saying, I hope you have a great day, and I hope that your clinical is great. You're going to do great today. So I'm guessing that the history with that particular nurse wasn't just me. Like, it was the team, period. The team that actually worked at the hospital, at the nurse's station as well. And so she was rude to me. She tried to attack everything that I was doing. And I just kind of laughed at it at that time because it was kind of hilarious. I think at that time I had a partner that was with me, another nursing student, and she was so upset about it. She was younger than me. She was in her early 20s, but she was like, what the hell is wrong with this nurse? I was like, girl, just don't let it bother you, because like, we're here for like 6 hours and I'm not about to let this woman upset me and get me out of character when I'm trying to complete my assignments here and give the patients their care. So it's like, either you will encounter patients that are hard to deal with, or you will deal with the nurses that you have to follow that are hard to deal with. So my top advice is to just go straight to your professor. Don't even deal with it. Don't stress yourself out. Do not let yourself have a bad day during clinical. It is already stressful. It is already anxiety filled for those of us that are anxious all the time. So just do yourself a favor. Let them deal with it. You can also demand to be reassigned to another nurse if your professor is not someone that is assertive enough to change you. Or assertive enough to go talk to the charge nurse of the day and get you changed to someone that can actually let you get your skills in or have confidence enough in you to perform for the patient or to give patient care. Just the bottom line, you don't have to deal with it. There's a lot that you don't have to deal with. So just make sure that you give yourself the best chances and the best opportunity to get the grades, the experience that you need while you are in clinical, so you can become the best nurse that any patient can have in the future when you do get your license, okay? So that's all I have to say for today. Hopefully this was helpful and inspiring to some of you that are unfortunately dealing with a-hole nurses. I'm sorry, but they're out there. Hopefully you won't be when you become a nurse and you learn from this experience of the type of nurse that you don't want to be. All right, hope you all are having a good day, good week, good everything. Many blessings to you all. Bye.